Imagine someone you love has a life-threatening illness and needs specialized care, and it's available here in Toronto, but you can't get them here. It's a situation people in Northern Ontario often face, and there's a charity called Hope Air that has been helping them with free flights for more than 30 years, but now it too needs help so it can keep helping those in need. Let me introduce you to one of its youngest patients. Meet 2-year-old Noah. When he was just 2 weeks old, doctors discovered he had a rare genetic kidney disease. Both of his kidneys had to be removed. He lives in Timmins and needs to go to the hospital for sick children regularly. It's too far to drive because he's tube-fed and on dialysis 12 hours a day. A return flight is about $1,000 per person. Do you have that money to do
We do not.
times a month?
We do not.
Noah's mother, Heidi, is not alone.
The average household income of a Hope Air patient is $35,000. If you think about the communities that we support all throughout Northern Ontario, Sault Ste. Marie, Sudbury, Thunder Bay, Timmins, there are thousands of people going to food banks every day, working people just to feed themselves. And now you're faced with a serious healthcare issue, yourself, your partner, your child, and you have to spend thousands of dollars that you don't have to get to care.
For Heidi Minot, Hope Air has been a lifesaver.
I don't want to get emotional, but into where Noah is today, he would not be where he is today if he did not have the bridge to get the access that he needs.
Hope Air has been operating on private donations since 1986, providing flights and hotel accommodation to people who have to travel to get specialized care for cancer, cardiac issues, transplants, and other needs. For the first time in its history in Ontario, it can no longer keep up due to growing demand.
In 2023, we supported over 1,000 patients and their medical escorts. And in 2024, based upon our projections, that will grow to over 2,000 patients and their companions.
That need is expected to nearly double by 2026. Hope Air operates across the country, but it gets financial assistance from other provinces. So Ontario is one of the only provinces that does not assist, does not put in some money.
Correct. We have partnerships with Newfoundland and Labrador, with Nova Scotia, with Saskatchewan, with British Columbia, with Alberta.
Last December, Hope Air made a formal proposal to Ontario's Ministry of Health asking for $2.5 million a year in funding so it could meet demand. That was 10 months ago. They've heard nothing since. So, crickets.
Crickets, we're hopeful that the government understands the issue. You know, we believe that where you live should not determine if you live.
Have you ever had to turn a patient away in Ontario?
Not yet, but that's obviously a major concern.
We asked the Ford government if it would help Hope Air, and if not, why not? In a statement, it said it acknowledges the unique challenges faced by people in northern communities, and its conversations with Hope Air are not over. And an update on Noah since that interview. He now has to live in Toronto full-time for treatment. His mother tells me they're living at Ronald McDonald House while they wait and hope for a transplant.